CNA Certification Exam Prep 2025, the ultimate guide to pass your certification on the first attempt. Question 1. When assisting a client in learning to use a walker, it is important to: Option A, stand behind him and use a transfer belt. Option B, put padding all the way around the top rim. Option C, let him walk by himself so he gains independence. Option D, let him practice using the walker on the day he is discharged. The correct answer is option A, stand behind him and use a transfer belt. When assisting a client in learning to use a walker, it is important to stand behind him and use a transfer belt to ensure safety and prevent falls. Question 2. Urinary retention refers to: Option A, a normal output of urine. Option B, an inability to urinate. Option C, incontinence. Option D, a large output of urine. The correct answer is option B, an inability to urinate. Urinary retention refers to an inability to urinate. Retention of urine is a symptom that should be reported to the charge nurse as soon as it is noted. Question 3. Normal hearing loss in aging is usually related to the ability to hear. Option A, high-pitched sounds. Option B, loud sounds. Option C, all sounds. Option D, rapid speech. The correct answer is option A, high-pitched sounds. Because of this aspect of hearing loss, the aged hear well if you lower your voice. Shouting in a high-pitched voice does not help. Question 4. The best way to safely identify your patient is by: Option A, asking his name. Option B, calling his name and waiting for his response. Option C, checking the bed plate. Option D, checking the name tag. The correct answer is option D, checking the name tag. A confused patient may answer to any name or lie down in any bed. Checking the name tag is the most reliable method. Question 5. Mrs. Jones is on a bowel and bladder training program. She has not had a bowel movement for 3 days. What should the nurse aide do? Option A, report it to the charge nurse. Option B, give the patient an enema. Option C, offer prune juice. Option D, increase fluids. The correct answer is option A, report it to the charge nurse. The nurse aide should report it to the charge nurse. Nurse aides cannot order a procedure or increase fluids. Anything unusual must be reported to the nurse in charge. Question 6. The proper medical abbreviation for before meals is: Option A, PC. Option B, BID. Option C, AC. Option D, TID. The correct answer is option C, AC. The proper medical abbreviation for before meals is AC, which stands for anti-SIBUM. Question 7. The proper medical term for high blood pressure is: Option A, diabetes. Option B, hypertension. Option C, hypotension. Option D, cerebrovascular accident. The correct answer is option B, hypertension. The proper medical term for high blood pressure is hypertension. Question 8. A patient who has difficulty chewing or swallowing will need what type of diet? Option A, clear liquid. Option B, low residue. Option C, bland. Option D, mechanical soft. The correct answer is option D, mechanical soft. A mechanical soft diet is easy to chew, swallow and digest for patients with such difficulties. Question 9. Mrs. Smith is an 81-year-old resident with Alzheimer's disease and cannot find her room. What should the nurse aide do to help Mrs. Smith feel more independent? Option A, scold her and tell her to stay in the room. Option B, ask her roommate to watch her. Option C, place a familiar object outside her room door. Option D, write the room number on a piece of paper. The correct answer is option C, place a familiar object outside her room door. Helping her locate her room on her own by using a familiar object would make Mrs. Smith feel better about herself. Question 10. How often should a patient's intake and output records be totaled? Option A, once each shift. Option B, twice a day. Option C, every 4 hours. Option D, every 12 hours. The correct answer is option A, once each shift. Input and output are totaled once per shift as well as every 24 hours. Question 11. Which of the following should you observe and record when admitting a client? Option A, color of the stool and amount of urine voided. Option B, how much the client has eaten and drunk. Option C, bruises, marks, rashes or broken skin. Option D, insurance information. The correct answer is option C, bruises, marks, rashes or broken skin. Failure to notice bruises or marks on the skin on admission may later cause someone to believe you were involved in abuse. Question 12. When responding to a client on the intercom, you should: Option A, ask for the client's name. Option B, say what do you want. Option C, give your name and position and say may I help you. Option D, say the nurse will answer your call. The correct answer is option C, give your name and position and say may I help you. When responding to a patient on the intercom, you should give your name and position to remain professional and helpful. Question 13. Which of the following things should you do to familiarize a new client with his or her surroundings? Option A, show the client where the call light is and how to work it. Option B, tell the client not to operate the television. Option C, ask visitors to leave the room while you finish admitting the client. Option D, raise the side rails of the bed and raise the bed to high position. The correct answer is option A, show the client where the call light is and how to work it. You should never leave a new admission until the patient knows how to call for help using the call light. Question 14. When arranging a patient's room, you should do all of the following except: Option A, check signal cords. Option B, adjust the back and knee rests as directed. Option C, administer medications. Option D, check lighting. The correct answer is option C, administer medications. Nursing assistants are never allowed to give medications. Question 15. When assisting a client in and out of bed, the nurse aide should always: Option A, employ body mechanic techniques. Option B, get another person to help. Option C, pull the client's feet out first and then lift the back up. Option D, put shoes on the client because the patient may slip. The correct answer is option A, employ body mechanic techniques. You should always use good body mechanics when moving patients to protect yourself and the client. Question 16. It is important to reposition a patient during an 8-hour shift. How often should he or she be turned? Option A, every 2 hours. Option B, every 4 hours. Option C, every hour. Option D, once a day. The correct answer is option A, every 2 hours. It is necessary to turn the patient every 2 hours to prevent pressure ulcers. Question 17. Which of the following is the correct procedure for serving a meal to a client who must be fed? Option A, serve the tray along with all the other trays and then come back to feed the client. Option B, bring the tray to the client last and feed after you have served all the other clients. Option C, bring the tray into the room when you are ready to feed the client. Option D, have the kitchen hold the tray for 1 hour. The correct answer is option C, bring the tray into the room when you are ready to feed the client. You should not bring the tray into the room until you have time to feed the client to keep the food at the correct temperature. Question 18. The most serious problem that wrinkles in the bedclothes can cause is: Option A, restlessness. Option B, sleeplessness. Option C, decubitus ulcers. Option D, bleeding and shock. The correct answer is option C, decubitus ulcers. The most serious problem that wrinkles in the bedclothes can cause patients is decubitus ulcers or pressure sores. Question 19. Restorative care begins: Option A, a week after admission. Option B, as soon as possible. Option C, when the patient wants. Option D, twice a week. The correct answer is option B, as soon as possible. Restorative care begins as soon as possible to prevent further complications. Question 20. You are told to put a client in Fowler's position. Before changing the position of the client's bed, you should: Option A, open the window. Option B, explain the procedure to the client. Option C, check with the client's family. Option D, remake the bed. The correct answer is option B, explain the procedure to the client. You should always explain procedures to the client before performing them to reduce anxiety. Question 21. During hand washing, you accidentally touch the inside of the sink while rinsing the soap off. The next action is to: Option A, allow the water to run over the hands for 2 minutes. Option B, dry the hands and turn off the faucet with the paper towel. Option C, repeat the wash from the beginning. Option D, continue rinsing as if nothing happened. The correct answer is option C, repeat the wash from the beginning. Touching the sink contaminates your hands, so you must start the washing process over. Question 22. You are going on a job interview. How should you prepare to dress? Option A, wear your best jeans and t-shirt. Option B, use a lot of perfume. Option C, wear simple clothing such as a dress shirt, pants or suit. Option D, wear a lot of jewelry. The correct answer is option C. Wear simple clothing such as a dress shirt, pants, or suit. Your appearance is important. You should wear professional business attire for an interview. Question 23. Mr. Brown, a newly admitted conscious client, has been put to bed. Before leaving him alone, the first action would be to: option A, ask him if he is hungry. Option B, inspect his skin. Option C, complete the listing of his clothing and valuables. Option D, make sure he knows how to use the call light. The correct answer is option D, make sure he knows how to use the call light. Always make sure new patients can call for help before leaving them alone. Question 24. When lifting a heavy object, the correct method would be to bend at the: option A, waist, keeping your legs straight. Option B, waist rounding your shoulders. Option C, knees, keeping your back straight. Option D, knees and waist. The correct answer is option C, knees, keeping your back straight. Keeping your back straight and bending at the knees forces you to use your strong leg muscles rather than your back. Question 25. At what time during a shift should a nurse aide wash his or her hands? Option A, before eating. Option B, after using the bathroom. Option C, before and after patient care. Option D, all of the above. The correct answer is option D, all of the above. Frequent hand washing is the first line of defense to prevent the spread of infection. Question 26. When assisting a client with eating, one of the first things the nurse aide should do is: option A, cut the food into bite-sized pieces. Option B, wash his or her hands and the client's hands. Option C, butter the client's bread. Option D, provide the client with privacy. The correct answer is option B, wash his or her hands and the client's hands. Always remember to consider infection control. Washing both the aide's and the client's hands is a priority. Question 27. A patient has a new cast on his right arm. While caring for him, it is important to first observe for: option A, pulse above the cast. Option B, color and hardness of the cast. Option C, warmth and color of fingers. Option D, signs of crumbling at the cast end. The correct answer is option C, warmth and color of fingers. A new cast may cut off circulation. Checking for warmth and color of the fingers monitors for circulatory impairment. Question 28. Encouraging a client to take part in activities of daily living such as bathing, combing hair, and feeding is: option A, done only when time permits. Option B, the responsibility of the family. Option C, necessary for rehabilitation. Option D, a violation of client rights. The correct answer is option C, necessary for rehabilitation. Rehabilitation should always be part of the care plan, and encouraging independence is essential. Question 29. In caring for a confused elderly man, it is important to remember to: option A, keep the bed rails up except when you are at the bedside. Option B, close the door to the room so that he does not disturb other patients. Option C, keep the room dark and quiet at all times. Option D, remind him each morning to shower and shave independently. The correct answer is option A, keep the bed rails up except when you are at the bedside. Following agency policy on bed rails is important for the safety of a confused resident. Question 30. Before assisting a client into a wheelchair, the first action would be to check if the: option A, client is adequately covered. Option B, floor is slippery. Option C, door to the room is closed. Option D, wheels of the chair are locked. The correct answer is option D, wheels of the chair are locked. Before assisting a patient into a wheelchair, always check to see if the wheels of the chair are locked for safety. Question 31. You are transferring a resident from the bed to the wheelchair. The patient has a weak left side. You should stand: option A, on the right side. Option B, in front of the patient. Option C, on the left side. Option D, behind the patient. The correct answer is option C, on the left side. You must assist the patient from the weak side to provide proper support. Question 32. While making rounds at 4 in the morning, a nurse aide finds a patient lying on the floor. What should she or he do first? Option A, call emergency services. Option B, perform cardiopulmonary resuscitation. Option C, call for another nurse aide. Option D, assess the patient's vital signs. The correct answer is option D, assess the patient's vital signs. Always check for vital signs first, as the patient may have fainted or have another medical issue. Question 33. When moving a wheelchair onto an elevator, you should stay: option A, behind the chair pulling it toward you. Option B, behind the chair pushing it away from you. Option C, in front of the client to observe his or her condition. Option D, to the side and hold the door open. The correct answer is option A, behind the chair pulling it toward you. You should stay behind the chair pulling it toward you to prevent the wheels from falling into the door opening. Question 34. The Foley bag must be kept lower than the client's bladder so that option A, urine will not leak out soiling the bed. Option B, urine will not return to the bladder causing infection. Option C, the bag will be hidden and the client will not be embarrassed. Option D, the client will be more comfortable in bed. The correct answer is option B, urine will not return to the bladder causing infection. Raising the bag above the bladder level can lead to backflow of urine which carries bacteria into the bladder. Question 35. Mr. Jones is a diabetic. For his afternoon tea the kitchen has sent a carton of chocolate ice cream. Your first action should be to option A, substitute Diet Cola for the ice cream. Option B, hold the nourishment and report to the charge nurse. Option C, ask the secretary to notify the kitchen of an error. Option D, ask if he likes ice cream. The correct answer is option B, hold the nourishment and report to the charge nurse. Always report abnormal conditions or diet errors to the charge nurse immediately. Question 36. When assisting a client who is using the bedside commode it is important to option A, leave the call light within reach. Option B, place toilet tissue close by. Option C, return to check on the client periodically. Option D, all of the above. The correct answer is option D, all of the above. All of these steps are necessary to ensure the safety and comfort of a client using a commode. Question 37. The hot water bottle is an example of a option A, local dry heat application. Option B, generalized dry heat application. Option C, local moist heat application. Option D, generalized moist heat application. The correct answer is option A, local dry heat application. A hot water bottle applied by itself is considered a local dry heat application. Question 38. Clients receiving an enema are usually placed. Option A, on the right side. Option B, on the left side. Option C, flat on the back. Option D, in a semi-sitting position. The correct answer is option B, on the left side. Placing the patient on the left side or Sims position allows for better entry of fluid into the colon. Question 39. A female client's perineal area should be cleansed before which specimen is collected. Option A, 24-hour urine specimen. Option B, midstream clean-catch urine specimen. Option C, pediatric routine urine specimen. Option D, routine urine specimen. The correct answer is option B, midstream clean-catch urine specimen. The clean-catch specimen requires cleaning the perineum to ensure the sample is not contaminated. Question 40. The most common site for counting the pulse is the option A, carotid artery. Option B, femoral artery. Option C, brachial artery. Option D, radial artery. The correct answer is option D, radial artery. The radial artery at the wrist is the most common site used for counting a pulse. Question 41. When counting respirations you should option A, wait until after the client has exercised. Option B, not tell the patient what you are going to do. Option C, count 5 respirations and then check your watch. Option D, have the client count respirations while you take her pulse. The correct answer is option B, not tell the patient what you are going to do. Telling the patient you are watching her breathing will often cause her to change her breathing pattern. Question 42. With catheterized patients which of the following is not the nurse aide's responsibility? Option A, inserting the catheter. Option B, preventing infection. Option C, checking to make sure the catheter is draining properly. Option D, recording output. The correct answer is option A, inserting the catheter. A nurse aide never inserts a catheter as it is out of their scope of practice. Question 43. When giving information to the charge nurse for an incident report you should option A, write in the client's chart that an incident occurred. Option B, keep the report in your personal file. Option C, state the facts clearly. Option D, give your opinions as to the cause of the incident. The correct answer is option C, state the facts clearly. An incident report is a legal document. You should state the facts clearly and avoid opinions. Question 44. All long-term care nurse aides must be competency evaluated and must complete a distinct educational course. These requirements are set by Option A, the Omnibus Budget Reconciliation Act. Option B, the Occupational Safety and Health Administration. Option C, the Centers for Disease Control and Prevention. Option D, the Food and Drug Administration. The correct answer is option A, the Omnibus Budget Reconciliation Act. Omnibus Budget Reconciliation Act or OBRA sets the requirements for nurse aid training and evaluation. Question 45. A resident is blind. It is important not to. Option A, leave the door completely opened. Option B, rearrange the furniture. Option C, announce yourself before entering the room. Option D, explain the location of food on the plate. The correct answer is option B, rearrange the furniture. Never rearrange the furniture in a blind patient's room as this can lead to falls. Question 46. When family members visit a client, the visitors should: Option A, stay in the day room. Option B, stay a short while so as not to tire the client. Option C, be expected to help with care. Option D, be allowed privacy with the client. The correct answer is option D, be allowed privacy with the client. Family members should be allowed private time during visits as it is a resident right. Question 47. A new resident asks you, if I need help or get sick during the night, who is going to be here? You should say: Option A, don't worry, you are not going to get sick. Option B, just yell and someone will hear you. Option C, ask your roommate to ring the call bell. Option D, there are people here all night to help you. The correct answer is option D, there are people here all night to help you. Telling the resident that people are there all night helps them feel safe and secure. Question 48. Which of the following is considered a client's right? Option A, having curtains pulled during personal care. Option B, having personal information kept confidential. Option C, receiving and sending private mail. Option D, all of the above. The correct answer is option D, all of the above. All of these choices are protected rights of the resident. Question 49. Mrs. Wilkes often cries while she is receiving her evening care. What should you do? Option A, tell her to stop crying. Option B, ignore her and continue with her care. Option C, tell her jokes to make her laugh. Option D, tell her that it is all right to cry and you are there for her. The correct answer is option D, tell her that it is all right to cry and you are there for her. It is normal for a person to feel sadness, and it is important for the patient to know the staff cares. Question 50. When providing denture care, the nurse aide must: Option A, wash them with hot water. Option B, hold them firmly under cool running water. Option C, place a towel in the sink. Option D, both choices B and C. The correct answer is option D, both choices B and C. Cool water prevents warping and a towel in the sink prevents breakage if the dentures are dropped. Question 51. Sexuality in long-term care clients may include all of the following except: Option A, needing private time with a partner. Option B, caring about one's physical appearance. Option C, engaging in public fondling. Option D, desiring sexual interaction. The correct answer is option C, engaging in public fondling. While staff must respect a resident's right to sexuality, public fondling is inappropriate and infringes on others' rights. Question 52. Mrs. Wilkes is scheduled for a partial bed bath. This means you must wash her. Option A, face, neck, ears, arms and hands. Option B, face, underarms, hands and buttocks. Option C, face, hands, underarms and legs. Option D, face, hands, underarms, buttocks and genitals. The correct answer is option D, face, hands, underarms, buttocks and genitals. A partial bed bath consists of washing the face, hands, underarms, buttocks and genitals.